Thank you. Welcome, everybody. Thank you so much for your patience. Before we start, I want to go through some housekeeping items before we get started. We will be taking questions at the end of the update, so we can do that using the Q&A feature at the bottom of your Zoom screen. So please type your questions there during the Q&A section. For those on the phone, you can dial *9. You can raise your hand and we will call on you to ask for your question. To unmute, you can use *6. So please keep your questions short, and we're going to get through as many as possible. I'm going to turn it over to Trina.
Thank you, Angela. Can you see my screen?
Yes.
Awesome. I'm going to talk briefly about our public health orders, the pared down versions that remain in effect from now until June 10th and through the summer. So the state still does have 2 public health orders in effect, and one of them regards the masks and one of them regards capacity. We also have a mask order in effect and a capacity order in effect. I will address those separately. The state mask order is in effect now until June 1st, and that order only pertains to certain high-risk settings like healthcare, schools, congregate care facilities. Our order likewise also pertains only to those settings as well, but unlike the state order, masks are required in those settings, the hospitals, doctors' offices, schools, indoor childcare camps, etc., regardless of vaccination status. With respect to the capacity orders, we are in level clear. We have been there since May 16th. That means that there's no social distancing requirements or other mitigation requirements in effect. However, on the statewide level, there are some very minimal requirements. If you have an indoor event, you are subject to certain capacity requirements under the state order. If you have more than 100 people in an indoor space, please pay attention to this. If you have more than 500 people in an indoor space and you are not a restaurant or retail, then you will need to speak with public health and get approval for that event. A little more detail on the mask order. In Boulder County, masks are required regardless of vaccination status in indoor preschool through grade 12 schools, indoor childcare, indoor summer camps. They're also required in healthcare settings, the emergency room, your doctor's office, physical therapist, chiropractor, etc. Masks are also required indoors in congregate care or assisted living settings. And the CDC still has an order that all public transportation requires masks while you are on that public transportation. This is only different from the state order in that masks are required regardless of vaccination status or group size. Masks are no longer required in most settings that individuals would be going to, such as retail stores. But there's a big but, which is businesses may still choose to implement mask requirements within their business. And that is their decision, and we ask that you are kind and respect those decisions. Boulder County Public Health does recommend that individuals age 3+ who are unvaccinated should wear masks when indoors around others not of the same household, or when they're outdoors and within 6 feet of other households. Our order, which is linked in this PowerPoint, which I understand will be shared, does provide some recommendations and guidance for businesses and organizations about how to make these determinations, whether a mask policy requiring masks is appropriate for them. And I'll turn it over to Lane Drager for more about those recommendations and guidance.
Thank you, Trina, and thank you all for joining. We've been doing webinars for the business community for a year, and we've just sunset those. But I do want to make sure anyone who may not be aware, those Those are all recorded and on the Boulder Chamber's website, as well as the Latino Chamber has been also doing recorded sessions. So all those are available on the Boulder Chamber's website. So anybody who wants to see any of those resources, please do that. They also have created a lot of signage and useful information for businesses. And Trina mentioned that we are now in an order where we're in the stage of being in clear. And really what that means is all of the specific requirements that businesses were under are now just moved into a recommendation. So all the things that have helped us prevent disease are still very effective. So social distancing, mask wearing, cleaning things, having good hygiene, all those things are good and still effective at preventing disease. And some businesses are choosing to still require masks. And as Trina mentioned, we do ask that you respect that and be courteous to those that are still choosing. We have people in our community who are not vaccinated. Some are unable to be vaccinated. And that's really our solution. But for those that aren't, we still need to be respectful and try to have ability for them to protect themselves. The specific requirements within businesses, there are no more requirements. We still would encourage them to look at opportunities to screen employees for illness. That's a very effective way to prevent outbreaks. So all the different things that businesses have been doing to be very proactive at preventing disease are still very effective to do that. The important thing there is if we still see situations where there are outbreaks, we may have to intervene and put in strategies to help prevent that, sometimes maybe even close down places until we can get things under control. So it is still in the best interest of all businesses to be as proactive as possible to prevent disease. But at this time, in Level Clear, there are no set requirements. The only exceptions under the state order that Trina mentioned are for those indoor events where there are still some social distancing requirements, and for large 500 plus events, approval for public health. And the things that we would be looking at are, again, those same practices that have been effective at preventing disease, the ability to social distance, really control flows of people, and things like that have been very effective at preventing disease. Again, I want to make sure folks are aware the chamber has signs for businesses that are still asking people to mask. Sometimes they're saying, some businesses are encouraging people, if you're vaccinated, you can take off your mask. They may or may not be asking for status, but please look at the entrance to businesses and see what they're asking folks to do. And we do ask that you really be adhering to what they're doing. There's still a lot of resources on our Boulder County website. I know Angela has shared those links, so we still would also refer you there. But at this time, again, there's no specific requirements that businesses need to follow under our orders. We're going to be continuing to monitor disease in our community. There is a snapback provision if we start to see hospitalizations rise. But at current time, our trends are very favorable. So we're very, very happy to see, and it's because the community is doing such a great job at getting vaccinated. That's our solution, and we really want to encourage those who haven't to please get vaccinated. And I think I'm going to turn it over to Elizabeth at this time. Thank you.
Oh, I'm sorry. Okay, can you hear me now? Okay, perfect. Okay, well, yeah, so it's been a great pleasure to be, communicating with you all this through these sessions. And now that is our last session, we have like all good news, all good news. And so one of the first good news that I want to share with you, and you have heard of this in the news, is that finally the Pfizer BioNTech COVID vaccine has been approved for kids 12 to 15, 16, 17, and so on. And this vaccine, as you have heard before, is a safe vaccine. During the studies, it was found that in this group of age, the efficacy of the vaccine against symptomatic COVID and laboratory confirmed COVID has been of 100%, so highly effective. There were no deaths reported among any trials with the participants in this case. And yes, most of them experienced, of the kids that were vaccinated experienced side effects, but most of them resolved within 1 or 2 days. The most common reactions that the kids manifested were local reactions, like, pain in the area and a little bit of, headache and not feeling good. And then again, this used to go, this one, disappear within a couple of days. Another important thing is that with this vaccine, before, we thought that these vaccines could not be administered with other vaccines within 14 days, either 14 days before getting your COVID vaccine or 14 days after getting your vaccine. You shouldn't be getting any other vaccines. Nevertheless, nowadays, after all this time that we have been using the vaccines and other extensive considerations in safety and the evidence, we have found that co-administration of these COVID vaccines with other vaccines is okay. So, at this point, if you, by any case, which is another phenomena that was observed, if your kid was not vaccinated for the other vaccines that they had pending because of the COVID, it's okay to get the vaccines even altogether. And, or within the 14 days, or, close to the vaccine, to the COVID vaccine. So, that's a good thing. You can take care of that as soon as possible. And of course, you may have forgotten with all this craziness about the other vaccines. So it's time to get up to date with those vaccines. So that's one of the good news that I wanted to share with you. And the other one is about the program about the vaccination at the workplace. And for this, I just want to share how you can access to it for any businesses that are interested in it. And let me see. So if you, are you able to see that on your screen? Perfect, okay. So this is super simple. So the program is called the New Workplace Vaccination Program, which means at work vaccinations. And that's exactly how you find it on the internet. That's the address. So you have to go to covid19.colorado.gov and then just add your at work vaccinations co. And they even have it in Spanish. And it makes sense, the name, because extension is Programa de Vacunación en el Lugar de Trabajo. So it's pretty simple to even the name is very simple. Now, once you get in there, you will find, this is the presentation page where it explains to the providers, to the people in the workplace or businesses, that this program is giving them the opportunity to bring the vaccine to their workplace, to their employees where they work. They don't have to go anywhere else. And this is a great advantage because we have observed hesitation on workers or people to getting the vaccine because it is an annoyance to leave the place, to leave for the vaccine. And then on top of that, having to keep a couple days for secondary effects, maybe won't be able to work for a couple days. And some people just cannot afford to do that. So this seems to be now, a good help for hesitation for those whose problem is that they don't want to go anywhere to get the vaccine. They may not even have transportation to go get the vaccine, but they can get it at work. And there's, nowadays there's some stimulus for even employers to help their employees to get vaccinated. So all you have to do is go to this website and then click on enroll in the vaccination, in the workplace vaccination program. And once you click in there, what you find is this form. All you have to do is complete the form. There are 4 pages that come with it. And the first one is just telling you to say how many employees do you have or you need to get vaccinated at your place. There is no minimum, but they ask to just kind of like be sensitive to the fact that it's very expensive to do this. So if you can have more than 2, that will be very nicely appreciated. So you just have to complete this form with how many and then say where you are. Not a difficult thing to do. And then just complete information about your business. What is the name of your entity? What is this kind of industry that you're working on? Your identification number, the address, obviously, and all of this information that you as a company most probably have, right? And then after that, you just click submit, and you'll be already officially in the system, and you will be contacted to tell you, how to proceed after that. And then again, all you have to do is provide all of these, and they will bring everything to you. And so it's not that complicated. It just started, and we're hoping that this can really help us with that sector of the population that is hesitant because of this issue. And that's all for the good news for now on my side. Thank you very much for your attention.
Tu atención.
Thank you, Lisbeth. So before Lexi closes today's update,
Entonces, antes de que
we
Lexi
will now open the
cierre,
meeting
entonces
for
vamos a abrir
questions. We will
la
answer as
junta.
many questions as time permits. Our presenters are approaching these topics from a place of respect, and we do ask that you do so as well. If we believe that that is not the case, we may need to mute a participant if necessary. I do want to go over those instructions that I went through at the beginning so everybody's aware how to use the Q&A feature. So the Q&A feature is right at the bottom of your Zoom screen. You can type your question there. If you're joining us on the phone, you can dial *9 to raise your hand and we will call on you to ask your question. To unmute, you use *6. Please keep your questions short. And we will be focusing on questions about the topics that we cover today. If you have questions that do not get answered, please send an email to healthinfo@bouldercounty.org. And I'll start the questions. Let me see what we have today. We have a great question about testing. How much longer will COVID testing at Stasio and Fairgrounds be available? When will you stop testing, and where could you get tested? I think I can answer that question. So we are phasing out some of the testing in Boulder County, but we also want to encourage people to keep testing even if they have been vaccinated and they have COVID symptoms. So I'll give you the date. So the Lions testing it sunset yesterday, but for the Stasio, it will be operational until September 30th of 2021. And the county fairgrounds will sunset on June 11th. We have other questions. So I think we have a question for Lisbeth. I think this is for you. Well, two questions about vaccines, Lisbeth. We have somebody asking that they're hesitant to vaccinate their children. They're asking, is it safe to vaccinate someone that's 13 years old? And will children experience the same side effects as adults? You're muted.
Yes. Yes, thank you. It is safe. It is safe. I mean, this is the authorization that was given was based on the studies on kids at 12 and up. So it is safe. Your 13-year-old is already proven by evidence, scientific evidence, that is safe. As I was saying before, in the studies, there was no, this was not even an anaphylactic reaction reported or deaths or anything like that. It's safe. And the side effects, the same as in adults. They're very similar. They disappear within a couple days, as I was mentioning before. And the most that they complained about the kids were about the pain in the area. That was, and probably that's a difference with adults, because adults, maybe they don't complain about it, but they feel it. But they, mostly adults were like, oh, I was very tired and headache and so on. Those may have been more notorious in adults, but with children was more like the pain in the area and maybe a little bit of fever that is controllable with your medication for fever that your primary physician recommends for you. Mm-hmm.
So would you recommend that parents or children have 2 days off from activities or 3 days off just to make sure that they're feeling well after their second dose?
Yeah, at least, at least to plan on it. Because, maybe, and this we have seen in adults, maybe they won't even experience that much, really. And they have the energy just like that, or, they feel happy to go places still. But at least plan on it, because you don't know how it's going to hit exactly your kid. And this is the same with adults. We know that these side effects are happening, but they don't happen to every single person. Every person is affected differently. And definitely they don't die from the side effects. I just want to make that clear, because sometimes people get scared, oh, side effect, and does that kill me? No, these are just effects that were observed among the populations where the vaccine was studied, and they just disappear. They just naturally come, telling us that your body is doing what it's supposed to be doing, that is generating that immune reaction, that defense. That's all that is happening when you're having side effects. That's all that your body's telling you. Not like you have been infected by COVID or anything like that, or that you're in big trouble. Nothing like that.
Thank you. Lane, you might have answered this question during your presentation, but we have somebody asking, as a business owner, can they require patrons to wear masks? And where can they get signage for this?
Yeah, you absolutely can. And I know several businesses are still encouraging that. The Boulder Chamber of Commerce has a whole host of signs, I think in multiple languages. So that's one resource that I would definitely refer you to. You certainly can make your own signs, that have the language that you prefer to use, but you are, as a business owner, able to require people to wear a mask.
Thank you. We have a question about level clear, and that might be you, Lane, or I can answer it, but they're asking what kind of data are we looking into to stay in level clear for 90 days? I can answer that. You're muted. I think for level clear, I can answer that right away. For level clear, just to give a little bit of background, this is a 90-day observation period under the public health order. And to remain at this level, the new hospital admissions for COVID-19 must stay below an average of 2 per day per 100,000 residents for 7 consecutive days as an observed over a 14-day period. So that is how we will determine if we remain on level clear. I have another question about vaccines. So it says, if people get COVID-19, can they get vaccinated, or how long do they need to wait before they can actually take the vaccine?
Yes. Yeah, definitely. You can get vaccinated. Not exactly when you're sick, but you can get vaccinated. There is a benefit to it. And definitely we haven't found that there is, like a risk to you to get vaccinated just because you had the COVID. So yes. And how long? Well, for one thing is until you finish all your symptoms. Once you're done with all your symptoms, we're talking, like the last time that you felt terrible. And then add to that 10 days to be safe, to finally go out and get vaccinated. And be safe. When I mean safe, meaning you don't want to give it to anybody else. Whatever you have remaining, you don't want to spread it. So that's one thing. And with that comes the next recommendation, that is until you finish all your isolation and all your period of quarantining and all that stuff. That's when you want to go out and get your vaccine. Mm-hmm.
Thank you, Elizabeth. We have a question for Trina. This is about masks. They're asking if people are required to wear masks for like personal care, so massages or hair salons, for that type of services. Do they need to wear a mask?
If the business requires it, then yes, you will need to wear a mask, but our order does not require masks. for personal services such as businesses and hair salons. Just a reminder, they are required for healthcare settings. So if you're going to your physical therapist or you are receiving a medical massage, you would have to wear a mask.
Thank you. And I think we have another one about masks. So it says, like, what is considered a low risk setting versus a high risk setting?
So those terms aren't used in the order as requirements. The low risk setting versus high risk setting really comes into where our recommendations lie. If you are a business that is not a school or childcare, but you cater to children who can't receive the vaccine yet, you might want to consider implementing a mask policy because you will have a large number of unvaccinated people within your space. If you're a business with a known membership like a gym and you've asked your members, hey, are you vaccinated? And you get a response that 90% plus of them are vaccinated, then perhaps you don't need a mask requirement in your business. So those terms aren't part of the order, but they can help you assess whether or not you might want to implement a mask policy in your business.
Thank you. We have another question about vaccines. When you're fully vaccinated, do you still recommend that people test for COVID if they have COVID symptoms? And Elizabeth, this might be for you, and just, can give us a background on what fully vaccinated means.
Yes, sure. So fully vaccinated, if you receive the Pfizer or Moderna vaccines, is once you finish your second dose, give it another 14 days at least. And that after that, you can say I'm fully vaccinated. And that in the case of the Janssen's is, after a couple of weeks of receiving the Janssen, which is only one dose. So that's that. But I'm sorry, if I was just clarifying that for a word. What was the reason? I'm sorry.
So do they need to test for COVID symptoms if they've been fully vaccinated? So they have those two courses, they've waited those 14 days, and then they have symptoms. Do they need to test? Do you recommend?
Yes, if you have symptoms, and this is going to be confirmed by your provider, right? So if you do have symptoms that are definitely what we consider highly suspicious of COVID, given the circumstances, yes, it still is a good idea to get tested. Mm-hmm.
Thank you. Hi, Lexi. I know you're going to close the event, so I was wondering if you are ready with information or we can continue with our Q&A.
Whenever you guys are done with the Q&A, I'm happy to provide a little data update and I'll close this out.
Perfect. We have 2 more questions. Elizabeth, again, vaccine question. Will the vaccine side effects be worse if I have an underlying condition?
Let's see. That's a good question. That's a really good question, because not that we found it in the studies that that's the case, but I mean, and this makes me think of people who have, for instance, conditions where pain is a big issue in their condition. So they certainly can be more prone to feel, to feel pain after the administration in the arm, for instance. And then you will say, well, in that particular case, yeah, there's a possibility that they experience more pain as a side effect. But because they have this underlying condition that already makes them make them prone to experience increased pain in general, because of the way of their disease is. But that we have found that other conditions make you more prone, not yet. And again, I just want to remind people that this is a vaccine that has gone through all the testings, all the stages, and it's such an important thing that it continues to be supervised. So still today and forever, after it went out to the public, there's still surveillance on it. So, and we're waiting for that surveillance data to come out, so to be able to say, yes, I'm now, based on the information provided by the after launching surveillance in the huge population, now we know that this can happen, this and this can happen as a particular characteristic in certain people, in certain populations. So we don't have that data yet complete, but so far we haven't heard anything of that. And if it is the case, it will come out. But then I just want to remind people that side effects don't kill you. They are just side effects. They are expected effects. There are effects called unwanted or unexpected or adverse events that were not observed really in the populations when they were subjected to the studies. And so when they come out, we just take note of them and see how to handle them.
Okay, the last question is, why is it important to vaccinate 12 plus? Why was that, decided, and why is it important that people vaccinate 12, plus?
That is another excellent question. So the kids, they do get COVID. That's a fact. There is no doubt about it. The kids get COVID. They get complications from COVID. They transmit COVID too. So that's the thing about it. There was in the past, I believe, that kids don't get COVID, they don't get sick. What is the point? Well, now we know that they do, and they can get, gravely ill from it and develop complications from them. There is a particular syndrome, the multisystemic syndrome, which we observe a lot in the kids. I mean, not like in the most of the kids that get COVID, but we observe it, particularly in them. And this syndrome, although it can happen in adults, kids are very, very, hugely affected. There's spectacular in them, and they require to be hospitalized. That is not like just something that you can do in your house, but they need to be hospitalized. So they do get COVID. They do get complications from COVID, and they transmit COVID. And this based in epidemiological observations from cases tracing and so on. We see how they bring the disease to the house for older folks too, and to their peers. So there is no doubt either that the kids transmit COVID. So that's why it's so important to also not only protect them, of course, but also include them in this chain of protection against the spread of the COVID and the stop of the pandemic.
Thank you, Lisbeth. We'll pass it on to Lexi.
Right. Thank you very much. Hi, everyone. Apologies for being a little late today. And thank you for joining us for our last community update. We will, of course, provide additional updates as the situation warrants, but this is our last regular update. And I will just take us through, our increasingly nice looking numbers to round out this last presentation. So here you can see that Boulder County is at 71.1% with at least one dose of the eligible population vaccinated. We're doing very well, along with a number of other counties across the state. If we look at the Denver metro area, we can see Boulder County is this red line here. We have clearly slowed down from this period of March and up to about mid-April. We have started leveling off, but we are still seeing an increase, a continued uptake of vaccination, which is great. It will be interesting to see if the new Colorado lottery for those who are vaccinated makes a difference. This is just a further breakdown of the number of folks with one course versus full course. You can see that a majority of our population now has the full course of vaccination with full protection. And this number is for age 12 plus. And what that signifies is that the 12 to 15-year-old population, which just became eligible very recently, actually is uptaking the vaccine very quickly, which is great news. They'll have a great summer. Here is a map this map continues to get darker and darker. One thing that I do want to point out is that the darker the color, the higher the concentration, the rate of vaccination in that area. And what's also important to understand is that although this area, this tan area is very large over here, it does not have a very high population. So even though we see it's a large geographic area, it's not a lot of people. And we are also seeing, great uptake in our Hispanic Latinx population. We do have some folks left to get vaccinated. The number of unvaccinated folks is shown in the parentheses for each of the age groups broken out by race and ethnicity. And what we are really learning is that the key to a lot of folks still getting vaccinated is really just making the access easier for them. We are hearing that hesitation is becoming less of an issue, that people are increasingly enthusiastic about getting the vaccine. Sometimes it's a challenge to get it. And so we're continuing to work on making sure that that access is as easy as possible. This is a comparison of our cases. We are down to 4.1 average cases a day over the past 7 days per 100,000 people. And our positivity rate is at 1.1%, which is terrific. We are definitely on the decline in cases right now. We had a little blip. I think it made the newspaper yesterday, but that was really about a particular testing company that had delayed inputting some of the cases, and it was a very momentary blip. It doesn't signify that we're going back up in the case numbers, and no one should be worried about that right now. And then just finally, to kind of round it out, we are seeing a decline in the vaccination rate. So we do want to encourage people. There's plenty of vaccine around, lots of opportunities. And we just really encourage everyone to go ahead and get vaccinated so that you can have a fun summer and not worry about getting sick or getting anybody in your family sick. So thanks so much. We just really want to thank everybody for hanging in there with us all these weeks and accompanying Boulder County Public Health in trying to overcome the impact of this pandemic on our community. And we wish you all, a great summer as we round out the school year and go into sunny days with lots of fun ahead. Thanks, everybody.